Okay. Hi guys, this is Dr. Bhupesh from Dr. BKM OET Institutes. Yesterday we recorded some questions of reading of part B, and also we recorded part A, how to do part A. And thank you for liking the videos. But yeah, would have been great if you would have more people would have watched. But that's all right. And don't forget to subscribe our channel for the best OET coaching. Now we are doing one more question of reading part C, which again you would love, because this is from the authentic material created by OET themselves, Cambridge and E2. So the main thing that we need to cover is questions. So what is highlighted as an important component of patient management? Important component means how do we manage the patient? Like what is the important component to manage a patient? Okay, let's go to the paragraph. Patient management. Yeah. So I can see this paragraph about treatment. So I'm reading this paragraph. There is no cure. Treatment focus on patient's ability to breathe. Medications like bronchodilators, aspirin, antibiotics are often prescribed, and such treatment as oxygen therapy and postural drainage may be recommended. If symptoms are so severe that medications do not work, surgeries may be recommended. So first is medication, second is surgery to remove the scar. Patients with asbestosis, like other chronic lung disease, are at a higher risk of serious infections that take advantage of the disease or the scarred lung tissue. So prevention and rapid treatment is vital. See, that is what OET or any reading is all about. I always say it's not only OET. I teach OET. That is why I talk about OET. But please understand, see this reading. What is important? Important has to be replaced by a word. Important means significant, crucial, critical. But now there is one more word, vital. So this line should have my answer. So what is important? So prevention and rapid treatment is vital. So that means prevention of what? Patient with the asbestosis have a high risk of serious infection. And then disease or these tissues take advantage of it. So main thing, if you can understand, is serious infection. So prevention and rapid treatment is vital. So that should be my answer. Okay. So sometimes people get into wrong things. Like they are just saying treatment focuses on. So this can be one of the lines that you can say but in this they are saying treatment focuses on ability to breathe. But they did not talk about any specific measure. Then they started talking about medications. Bronchodilators will help to breathe. Then surgery can remove the scar tissue. But then again, the only thing they talked about in the vital is infection, prevention and treatment of infection. Flu and pneumococcal vaccinations are a part of routine care. Patients with progressive disease may be given corticosteroids and cephalo cephalosomide, whatever, cyclophosphamide with limited improvement. So these are the points given, but my keyword is hidden over here. That is what you need to understand. And then you can do any reading. Then you will not have problems. So now I have to find something. Yeah. So there is my answer, infection control. So it makes my life easy to understand this word. Always focus on the question. Your question contains the answer. The way you read the question will determine how good your answer would be. So they were talking about steroids. Yes. They were talking about, yes. They were talking about excision. Yes. But the first thing was not medication. First thing was not surgery. The main thing they wanted is infection control. And if I say early intervention word does not have the word prevention, because they said prevention and rapid treatment. That means they were talking about infection control. So according to me, answer should be B. Then again, I'm taking one more question because somebody asked me 13th question over the chat box. So I'm taking that question as well. The writer states that the products made from cryo style is okay. So let's see what are the products made from this and what are they talking about. Okay, so they're talking about never try to pronounce the word. So I will say this word as C. C is the only form of asbestos that is currently in production today. Despite their association with the lung cancer, C products are still used in 60 countries. So it can cause cancer, but still it is being used in 60 countries. Although the asbestos industry proclaims The safety of the C fibers, asbestos industry says C fibers are safe, but they have been associated with the lung cancer and they are still currently used. They are the only form. But asbestos industry says there is no harm, which are now embedded in less febrile and dusty products. Little is known about the long-term effects of these products because of the long delay in the development. So that means little is known, that means we don't know much about it. Little is known means very less is known about these products. In spite of the potential health risk, the durability and the cheapness of these products continue to attract commercial application. That means commercial always means business. So for the business, for the commercial point of view, they are still being used because they have high durability. Durability means they stay for the long time, and cheapness. Asbestos remains a significant clinical problem even after marked reduction in the job exposure to asbestos. Even after doing marked reduction, marked means significant. Again, never forget these words. Even after significant reductions in the on-job exposure, it still poses a significant. Again, this is due to the long period of time between the exposure. And why this poses problem? Because there is a long period of time between exposure when you are exposed to C fibers and the onset of the disease. So onset of the disease takes a very long time. So now let's check out what they are talking about. So I'm just going to do this question in a very easy way again, not making it complicated at all. 13th question. So the question was about crystallite fibers. Now we know crystallite fibers are kind of cancer producing, but little is known about it. So they have restricted application. No, they were saying due to high durability and this they are used lot more. So they don't have restricted. Restricted means limited, but they have high application because of commercial purposes. So this cannot be my answer. Elimination. May pose a future health threat. May word, as always I say, is very important. It can pose a threat. Yes, it can lead to cancer. This can be a very strong answer. Enjoy approval. There was nothing about approval by the regulatory bodies. Nothing like this was discussed. Crystallite fibers are safer than early asbestos. There was nothing in the paragraph that was saying that C fibers are better than previous fibers. There was no comparison. That is what I say, second degree. Safe, safer, safest. Late, later, latest. So later, safer. They are second degree, comparative degree. In the paragraph, there was no comparison. So the only answer I can do is I will make you read the paragraph again. If you want to read one more time, I will read it for you just as to make sure that we don't do. So there was no comparison of C fibers with the old fibers. No comparison. So they were just talking about C fibers, safe, 60 countries, embedded in febrile. Little is known about these products. In spite of the potential health risk, products continue to attract commercial applications. That means there is no restricted application. They are being used more. So your option eliminated, comparison was not given, and they were not talking about anything else. The only thing they were talking about that it may. Asbestos remains a significant clinical problem, even after mark reduction. So it is still a clinical problem and can pose threat. But elimination method again would help you. And there is the word in spite of the potential health risk. This word potential means it can pose a threat in the potential always means you are a super potential. That means you have the potential to become a great person in the future. Potential word is correlated with future always. So that is where you should have gone. That's why answer becomes B, but it's very hard to find this word. First of all, you need to eliminate other options. That is how the things will happen. Now, by chance, I'm doing this question as well. Nobody has asked me, but these questions, sometimes people say have a lot of problems to find these words, but try to read these two lines. Asbestosis remains a significant clinical problem. Don't read this. Again, this is due to the long period. So this means it is a significant clinical problem. This is due to the long period. So this means over here, it's a significant clinical problem. So if I have to do this, asbestos, ongoing medical issue. That is how simple OET readings are, if you understand. This is due to what is clinical significant problem, that it is a significant problem which is ongoing. It is a clinical problem. Clinical means medical. Asbestos. See, I will read it again for you, so I do not rush in things again. Asbestosis word is given. Even the word is given asbestosis. If you will see it clearly, remains mean that is even now a significant. Remains means it's an ongoing thing. Remains means it was there. It is still there. It is an ongoing thing. So that is where, if you will listening to this reading one time might help you, but listening to it three times will make you perfect. Please listen to this recording again, then again, and try to learn how easy OET reading is. This is Dr. Bhupesh from Dr. BKM OET Institute. Our contact number is 76967 34256, and you may contact us for the best OET coaching. Thank you.